All right, hi everybody. Thank you very much for joining us. My name is Tanya Haas and I am the Health and Wellness Writer here at Medcan. Welcome to today's online seminar, Get a Running Start, How a Beginner Can Train Like a Pro. And now before I introduce our presenters today, there are a few housekeeping items to cover. This presentation is being recorded and will be made available at medcan.com under Medcan Insights. And regarding the audio, due to the volume of participants we have online and on the phone today, we will be muting all incoming calls. But that being said, if you do have questions throughout the presentation, you can pop in a question right here on your screen, and our presenters will be making time at the end of their presentation to answer some of the questions. And finally, the information in this online seminar is for educational and information purposes only and is neither intended not to be relied upon nor to be a substitute for professional medical advice, diagnosis, or treatment. Now, with all that being said, I am honored and excited to introduce our presenters today. Our first presenter is Jenna Martin, and she is a personal fitness trainer here at Medcan. She's an avid runner and cyclist and has worked at Medcan for 6 years. She graduated from the University of Waterloo with a Bachelor of Science in Kinesiology, and she's also a registered holistic nutritionist. She enjoys coaching runners on the trails, the gym, and in the kitchen. Thank you for joining us, Jenna.
Thanks for having me.
And our other presenter is Dr. Andrew Miners, or Andy as he is known around Medcan. He is a fellow of the College of Chiropractic Physical and Occupational Rehabilitation and is designated as a chiropractic rehabilitation specialist. He is the director of Sports Therapy and Rehabilitation at Medcan. He is a certified strength and conditioning specialist and a certified kinesiologist. Thank you. And he's a provider of various soft tissue and clinical treatment techniques, including active release techniques, Graston, and clinical anatomical acupuncture. Dr. Miners was selected as a member of the medical team at the 2010 Vancouver Winter Olympics. Thank you so much for joining us today, Andy.
Hi, everyone.
All right, now today we're going to be discussing what you need to know before you start, how to become an efficient runner, periodized running plans, nutrition, hydration, and rest, and avoiding injury and injury management. And then, as I said, we will have time for questions. So without further ado, I'm going to pass the mic over to Jenna. Thanks, Jenna.
Thanks, Tanya. Hi, everyone. So I'm going to be starting with what you need to know as a runner, how to avoid injury. Beginning with knowing your body type, your weight. I thought of this just for myself. I tend to be more of a mesomorph, muscular type build. And running for me has always been easier in speed work. That being said, I have worked towards marathon distance, but it's important to know what you're good at. Knowing your limits, so current or previous injuries, and also appreciating that all distances are admirable and have very different training focuses. So whether it's a 5K all the way up to a full marathon. Also looking at quality over quantity. So what that means to me is if you know that you have time for 3 days a week training, taking those 3 days, you can commit to, say, 2 in the morning during the week and 1 on the weekend. If you can commit to that, you want to make the most of those 3 days and train for something that's realistic for that amount of time, as opposed to right off the bat training for a full marathon, which is definitely going to take more commitment. So that leads me into becoming an efficient runner. It's all about efficiency. We'll be looking both aerobically and mechanically. So first, aerobically. Now, there's nothing to replace sport-specific training. So that means that you naturally have to run to become a better runner. However, cross-training goes a really long way to improve your aerobic capacity, so especially in beginners, improving your what we call VO2 max. So that can be done through biking, swimming, hiking, circuit training. This is one reason I love triathlons. Just putting in a little plug for triathlons. And as well, training aerobic threshold through interval training. So that's when you're looking at different programs that are out there provided. You want things that include short and long intervals, just because this is a more efficient way to reach your aerobic threshold, as well as improving speed without increasing your mileage on the road. And so that's a good injury prevention tip. So now moving on mechanically, we're looking at biomechanics. This can be done through strength training. That's a big component for beginners. This is essential for all levels, but starting out, I usually recommend there to be a good one-to-one ratio for runners, for running to strength training. So that can be a shared one-to-one ratio, and slowly moving towards more running as mileage increases. And of course, depending on the season, if you're in off-season, you may do more strength training. And then, yeah.
I'm just going to interject. That's a great point. I think a lot of runners just get into running, and they think running is enough to run. And one of the major mistakes I think that a lot of beginners do is they don't do the appropriate strength training. They just start to run.
Absolutely.
And a lot of times cross-training, doing a one-to-one ratio is extremely important to build up their strength so they can run.
I agree. Speaking of mechanics, I call it a breakdown in your frame. So typical thing I see in beginners especially is a sway from side to side, which can happen from a bit of hip drop. And this is like a little mini energy leak every step you're taking, and that adds up, especially if you're working towards a marathon. So things like improved mobility through the ankles and hips, as well as strengthening your core, your glutes, quadriceps, that all allows for a better freedom of movement and a better power output through each stride. So that just means that you're not feeling those aches and pains on each movement, and you're propelling forward as opposed to lost energy side to side.
I agree, Jenna. That's important. One of the people, just because people can run doesn't mean that they run well. Mm-hmm. I use the analogy of a golf swing. I can give a golf club to anybody and they can swing it. That doesn't mean they're going to hit the ball or they're going to hit it straight. But with some training, some drills, and some strengthening, they can usually get off on it and they can hit the ball well, or at least better than they did before. And running is a little bit like that. Anybody can run, but they may have these energy leaks that you refer to because of faulty strength, faulty flexibility, or form issues. They might be overstriding, understriding, may not have a good sense of what their tempo should be when they're doing a certain distance or doing a certain type of run. Mm-hmm. And so that can be trained. People can do drills to improve their mechanics. They can do strengthening to improve their efficiency of running by having more resilience of their tissues and stronger tissues to propel them forward. So that's also, I agree emphatically that that's a great point.
Just the same way if someone was starting out to learn to become a better tennis player, they don't generally go out and just hit the courts with no training at all. So it's the same with running. It's always better to start out with a coach at the beginning. Improve.
Important. Every other sport you get a coach.
Every other sport you do.
Right? So. Every other sport you do practices and you drill.
Okay, so moving on to periodized running plans. So this specifically for runners, looking at what does periodization mean for running. In running, it means that there is a systematic increase in mileage. That makes sense. At the same time, there's also proper cycling through different aspects of training, so things such as speed work, endurance, hills, so that your body will always be adapting to a different stimulus in order to peak, perhaps towards race day or just going towards peak performance in general. I like to coach beginners through a 4-phase program. I always encourage shorter races at the beginning. It's nice to actually add races interchangeably throughout your training program. These programs always include direction in strength training in tandem with the running program as well. So that's something to look for. So a little example, I'm not going to go too into depth here, but if we're training your aerobic conditioning, so that's the beginning, getting you out on your feet, actually running, this is a good time for cross training as well, getting your aerobic capacity up. Really important to look at core stability and freedom of movement, so that's that whole hip mobility, ankle mobility. And then phase 2, once you've conditioned a little bit more, looking at shorter intervals. This is tough. Short intervals, otherwise known as speed work. Form corrective drills, otherwise known as hill training. That's a really good one. Unilateral strength and balance. So that's single stance work, just because running is obviously you're on one leg at a time. So it makes sense to do that in your strength training as well.
Very important.
So single leg deadlifts, walking lunges, for example. Moving towards longer intervals and endurance, circuit training, because that's good, allowing your muscles to to also deal with endurance. Actually, this is a good time to talk about
Injuries.
Just tissue tolerance.
Yeah, and you mentioned, about periodization around races, but if people aren't racing and they're just doing it, periodization can be a way to prepare or train for races, but it's also a way to mitigate injury by not doing the same thing all the time. Now, I see on this, we've got two graphs up on the screen right now, and these are showing sort of two different models of simplified but accurate in terms of how certain injuries can occur. On the left, we see peak force injury, and this is a good idea. When we talk about tissue tolerance, you can think of it as about our injury threshold. Okay, and every tissue, and you could argue every person has some level of an injury threshold, meaning what they can do, how much load they can put through their body or body part until that body part becomes injured. In the first instance, along the blue graph on the bottom that's all spiky, that's the applied load. So if your tissue tolerance or your ability of your muscle, your Achilles tendon, your quadricep, or whatever tissue it is to tolerate load, that's that upper red line that's above there. Now the applied load, the first peak is a load that might be jumping off a box. Okay, your muscles are very well able to tolerate it, so you've got this margin of safety between the peak of the blue and the bottom of the red line. Okay, you haven't breached your injury threshold or your tissue tolerance. On the second peak, or the first arrow there on the left graph is showing to injury, could be something like instead of jumping off a box, you fall off a ladder, and you have a peak load or a large force that goes through a tissue and causes an immediate injury. Okay, think of that like a pulled hamstring from sprinting and not being used to sprinting, or breaking a leg, or spraining an ankle. That's where the force exceeds the tolerance of the tissue, and subsequently we get an injury. And with an injury comes certain things: inflammation and pain, loss of function, reduced mobility. Now, when we talk about running, that's not, the one on the left is not usually what we see with running. Not that it can't happen. You can sprain an ankle, or you can, if you're doing speed work, blow a hamstring. But a lot of times what we see is repetitive strain injuries in running. Running is kind of the definition of repetitive strain. It's doing the same thing repetitively over and over and over and over and over again. As Jenna pointed out, I think single leg strength is important because running is a series of single leg stances interrupted by periods of float. You're going right leg, left leg, right leg, left leg. And so in this second graph on the right-hand side, this is a cumulative force injury model. And what we see in the applied load, and this mimics sort of running. So think about right leg, left leg, right leg, left leg. And that's that up and down blue line that we see there. That load is well below our tissue tolerance at the beginning. Okay? But as we do it repetitively over time, because of fatigue and tissue weakening, our tissue tolerance starts to drop over time as that applied load is given. And at some point, if we're not careful, that applied load, although it's the same load it was at the beginning, because our tissue tolerance has reduced over time because of fatigue perhaps, we have again an injury moment where the load breaches the tissue tolerance and we've ruptured our injury threshold and an injury occurs. And so that's kind of a model that fits with a lot of running related injuries, of why people run and run and run and everything was fine, and then all of a sudden they start to feel pain. And later on in the talk, we're going to talk a little bit about the phases of injury and how that might relate to that perception of running. But when Jenna talks about periodization, by varying the load, i.e. what you are doing as part of your training, with strength training, some running, some tempo, you're not always just doing the same applied load. You're varying it. You're allowing your tissue to improve tolerance by getting stronger, so you move the red line up. And by taking rest days, which is an integral part in terms of periodization, you allow your red line to recover, so it's not constantly being fatigued and worn down over time.
That's right. And just to interject on that, it's a good reason why, as you're beginning, a lot of programs you'll notice will start with the walk run. And it doesn't mean that you're going to do that forever. That's not your long-term goal as your red line improves. But starting out, your tissue tolerance is going to be shorter at the beginning. So let's say you're doing a minute of running, a minute of walking to begin. It allows you for that minute of running to be focused and your muscles are actually engaged, which is going to protect your joints. When you're walking, you're having that recovery.
I call it training endurance without getting tired.
Yeah.
Right? You want to train quality, not quantity. If you keep running past your fatigue threshold, you're more likely to hit your injury threshold, because your form is going to deteriorate. You're not going to be having the same resilience in your tissues to absorb that energy repetitively, and you have problems.
You're being mindful of your running time. So speaking of periodization, a really good way to track everything, because it's actually really tricky to track it on your own, is making sure that you have some sort of GPS activity watch. You can use your phone, of course. Any smartphone will do this. I love the gear, though, and if you're motivated by that, a lot of people are. It's fun. Cool. It's a good way to create some community. A popular app right now is Strava, for instance. I compare it to like Twitter for endurance athletes, actually for any athlete really, but it's tracking where you are on the road. It uploads all of your GPS, all of your routes that you've done, and so that people that have been added to your community can see where you've been, what you've done. It's a bit of accountability, just something to look at if you're looking for some motivation out there.
I think that's key, tracking what you're doing so you're not just running aimlessly, because that's how you can lead to that fatigue factor. But I feel good, so I'm going to run for a really long time.
Yeah.
And maybe you're going to breach something and do too much.
Exactly. Or you get lost, and then you have a really long run.
Yeah.
Okay, so moving into nutrition, hydration, and rest. So one thing I'm going to point out here is just I've put this little equation: maximum power output plus lighter body mass equals optimum running performance. It's no surprise that the lighter you are on your feet, along with your power output, it's no surprise that you're going to be faster in that case. Not everyone is built like a runner, which is a very slight, lean build. A lot of people, however, when they begin running, they start because they're looking for weight loss or weight maintenance. And of course, running is helpful for that. But I often see there are a few common mistakes. So the first being overeating. There's a sense of just over-justifying what you've done on the road and saying, okay, I can go and have a hamburger tonight. I might not otherwise do that, but I just ran this morning, so sure. You're going to have an increased appetite, absolutely. And not eating the right fuel pre or post is going to really contribute to that. So when I say post specifically, if you've just gone out for your run, it's nice to be able to eat a meal right afterwards, but another good way is getting a good protein shake or something that has a combination of carbs and protein. Just basically you need to replenish those stores in your muscles that have been depleted. Otherwise, you're going to find later in the day that you're going to be starving. And so that's no good either. So looking at that kind of basically anywhere immediately to about 1 hour post-run or exercise, that's your optimal time to be eating. Undereating is also a common mistake. So again, along with the weight loss, undereating or wanting to run on an empty stomach, that can be fine first thing in the morning, especially if you are looking for weight loss and you want to kind of really deplete those stores, get into fat stores. But if you're going for performance, this isn't going to be, you're going to find you're sluggish. Sometimes you can even feel nauseous. What's happening is you're going into your liver glycogen stores and you're having to break that down. So you'll notice there's a quick drop off in your speed as soon as you are not using carbohydrates. So that leads me to the next point, is why for runners, following a low carb diet, which is popular these days, of course, is not, I would not recommend that for runners. That doesn't mean carb loading either. So that doesn't mean going to pasta meals all the time. It's simple stuff. It's like if you're having a salad at lunch with protein, adding a quarter to half a cup of complex carbs, things like brown rice, quinoa, sweet potato, things that are slow releasing. But what you do eating on your daily basis, that is such a part of your training regime that I can't express that enough. It's not just what you eat right before your race or right before your run or during your race. It's what you've done all throughout, because your muscles get better at using your carbohydrates and actually turning them into glucose so that you have energy.
Food is fuel.
It is, yeah. So you have to teach your body to use that fuel properly. Hydration. Also on that same note, we can get really specific on how many cups you should have, before running and exercise. But in general, just increasing your water intake. I think most people don't drink enough water in general. So aiming, maybe this is an ongoing goal, but aiming for something like 2 liters a day. That can seem ridiculous to you right now, but starting with getting a good water bottle and putting it at your desk at work and just drinking that throughout the day. 1 to 2 cups of water 2 hours before exercise is what they recommend, or a cup of water 10 to 20 minutes before. Again, if you're waking up early in the morning, you're not going to be chugging water 2 hours before you go out running. So the day before, make sure you're drinking more water. I don't really recommend sports drinks at this point, especially if you're just starting out. You're realistically not doing anything over an hour, so you don't need to have any sort of extra glucose during that hour. What you've eaten, what you've stored is already sufficient, so water is your best friend. And then during your training, so hydration during your training fluids, again, just keep it simple. Aim to consume small amounts every 30 minutes. If you're actually in a race, of course, you can stop for a second and go to look ahead at where all of the water stations are going to be on your race. So planning is really important, just looking at what sort of distances they're going to be between water stations, and just getting a mouthful. Take a mouthful, you can spit it out, but just to kind of replenish slightly. They'll probably be every 30 minutes anyways. Again, if you're under an hour, don't worry about sports drinks. If it is, then I like doing a mixture of sports drinks and water. And again, you have to practice with that. You don't want to do that only on race day. And always staying away from fruit juices because they're just too high of a concentration and they'll give you cramps or GI distress. So now getting into sleep and recovery days. I like to say active recovery is more what we're looking at here. So taking your rest days where you're not running, you're not on your feet. It's not a strength training day, but it's a good day to do some more stretching, getting out and doing a yoga class. Maybe that's putting it in your schedule, just the same way you would have a running program. Also working on your stabilizers, so things like clamshells and bird dogs, and doing some good quad stretching and calf stretching. Anything you want to add there?
No, I agree. I think although doing nothing is sometimes indicated too if you've been pushing yourself really hard and you're feeling fatigued, because you also don't want to get usually beginners don't fall into the overtraining phases, but it can occur. Sometimes people get in and they feel so good starting a running program, they start running every other day, and soon that turns to every day, and then they pull into that repetitive loading phase. And so giving yourselves time for yourself to recover, because just like working out, when you do a heavy weight and you're doing a bicep curl, for example, and you're doing a 40-pound dumbbell and you're using it, you're causing micro damage to the tissues that you need to heal from in order to adapt. So you put a load in to your tissues, and if it's a positive load, your tissues will adapt strongly and they will get stronger over time. If you don't allow enough recovery or rest, it doesn't have time to heal and recover from that imposed demand. And that's when you lead again to overuse, repetitive strain, tendinopathies, which is really common in runners, so tendon pain around the knee or the Achilles. So recovery is important, but I agree with you in terms of proper sleep, which is part of recovery.
Yeah, absolutely.
Right? Making sure you get the appropriate sleep. That's good for mental health and stress management and everything. But doing active recovery, doing a yoga class instead of a run, doing some resistance instead of a run, doing a spin class instead of a run is all good.
Yeah, that whole cross-training piece. Great.
Oh, okay. So we're moving on to talking, and it links directly in what Jenna was just talking about in terms of injuries. So I'm going to talk a little bit about avoiding injury and injury management, and I've touched on some of those points. And now this I don't agree with everything that's up on this, but this is up there just sort of to illustrate that pretty much anything that can get injured could get injured. So what we see with runners is the number one thing that gets, is lower limb injuries, or obviously, so injuries to your legs that are the number one area of complaint in runners. And of that, the number one complaint with runners is knee pain. Okay, and the most typical of that is being patellofemoral pain. That's the number one complaint that people with running-related injuries report most commonly is knee pain. So we can move on from there. So avoiding injury and injury management, we talk about avoiding injury just as we talked about using periodization, having an understanding of what your injury threshold is. Going back to one of Jenna's first point, which is knowing your body and knowing your tolerances, knowing your limits is important. So you want to ease in gradually. And one of the things Jenna touched on, and I like to reinforce, and this is if you're recovering from an injury or if you're just starting to run, is trying a walk-run progression. And this is just an example. This is just an example to give you an idea. And again, the goal of any thing, you don't start running a marathon right away. You build yourself up to it. Now, if your goal isn't a marathon, your goal might just be 5 kilometers. You need to wean into it. So again, it's to build up your tissue tolerance to that load or that repetitive activity gradually over time. So usually I start, you're running 2 days a week, and this is example. So for example, in week 1, that 5-W is 5-minute walk. That's my shorthand for a 5-minute walk. So you start with a 5-minute walk. And then you're doing 3 sets of a 1 kilometer run intermixed with a half-kilometer walk. So you run a kilometer, walk a half, run a kilometer, walk a half, run a kilometer, walk a half. And then at the end you finish down with a warm down of about another 5-minute walk. And that gives you about 4.5 kilometers per day, but you're really only running 3 of those kilometers interspersed with periods of that. If you do that twice a week, you're looking at a volume overall of about 6 kilometers. So that's my shorthand. And then as we progress from week 1 to week 2, week 3, week 4, week 5, you're seeing that if you look at the far right, your volume total per week is increasing. You go from 9 to 12, and then it's a repeat of 12. But then you drop back down in week 4, and that's a recovery period, which links back to what Jenna was talking about a form of periodization, giving yourself a recovery week. And then it bumps up to 15 kilometers in week 5, and then again, a little bit of a drop down in week 6. And then if we look on the next stage in, you're getting 5 kilometers per day, and then in the rest week you're at 4.5 kilometers, then you're going up to 5, and then 7 kilometers. But on that week 6, you're running 3 kilometers straight with a half-kilometer walk in between, and you're doing that twice, so you're really running 6 kilometers. So that would take you up after that, up into a 5K race range, right? So it's a great way to do that. Other things to think about is variability of surfaces. Don't always run the same route all the time. Variability is good for building up your tissue tolerance. Changing shoes often, even having more than one pair of shoes is good. Changing your surface, so running trail running or road running, so don't always run the same way. Think about your cadence, and we talk about 180 beats per minute, and that's total. You can think about 90 beats per leg, so how many times your foot should strike the ground in a minute. Now that's variable in terms of a lot of different factors, but if you're a way to measure this quickly is if you've got a sport watch, you set your sport watch to beep at 30 seconds, and you start running. And so you hit start when your left leg hits the ground, and you count how many times your leg hits the ground until your watch beeps. And you take that number, you multiply it by 2. That gives you how long you're hitting in a minute, right? So you multiply that by 2, and that gives you up to the 180 for both legs. So if you're much lower than that, if you're about 150 or 160, you're probably overstriding. You're either running way too slow or you're taking too much stride with each foot. If you're way higher than that, you're probably taking these short little choppy steps, and you're not getting anywhere. So it's a good target to sort of work at. And the other thing to think about is keep your foot strikes light and soft. I don't want to get into whether you're doing different types of foot striking, just keeping your foot like straw. If you're coming down and you're standing like this, you're probably impacting the ground and giving your body too much loading up your chain. So think about just soft, quick steps. So that's an example of things you can do. Other things you can think about, talk about variety. Try different tempos that it goes along with periodization too. Have a long day and a tempo day. Pick a few telephone poles and increase your cadence during that time. Again, active resting, like doing yoga we talked about. An important thing, we look at injury prevention for knee pain, for example, which is really common with runners. They've done studies in runners that have patellofemoral pain, which is a fancy way of saying knee pain. And all they've done is strengthening of their glutes, their abductors, gluteus medius and minimus, and their incidence of knee pain reduced. So keeping up your butt strong is important, not just quads, but your whole leg strength is important. Improve that resilience, which, going back to my graphs, which pushes that red line higher up. So you're more tolerant to the activities that you're doing. So after, those are things you can do to prevent injury. If we move on to, do I have an injury? Because a lot of times people feel discomfort and feeling tightness, soreness, achiness, stiffness, different things that you might feel during a run. Is it an injury or is it not an injury? So going back to my graphs again, when we reach that injury threshold, and especially with a running, you're going over time, you're doing the same repetitive activity, your threshold might drop, and eventually it breaches and you have a pain response. Okay, so is that serious? Well, typically with runners, we go through these 4 stages of running. At the beginning, you get mild discomfort. So you're running along and you feel a little bit of discomfort, maybe that's more in stage 2, but you're running along, no problem, but then you feel a little pain the next day, right, or later that evening. And I felt a little tight, a little stiff, a little sore, a little discomfort, but you ignore it, right? It goes away, wake up the next morning, feel okay. So stage 2, which can progress in terms of these repetitive loading injuries, is you've got discomfort, not so much pain, but you start to notice it during your run. You're starting to know that little bit of knee pain or that a little bit of Achilles pain during your run. And that's typical with what runners tend to feel. And a lot of times runners run through that also, right? It's fine, I can keep running. Mm-hmm. Stage 3 is when now you're getting more significant discomfort. Now that discomfort is now, it's pain now, okay? And it's starting to affect how long you can run or the speed or tempo of your run. It's starting to affect your ability to run. And obviously we're going from stage 1 to stage 4, we're getting more severe over time. And then stage 4 is the most severe, and that's when you clearly cannot run anymore. So in clinic, I typically see patients around stage 3, sometimes stage 4. But there's interventions you can do around stage 1 and stage 2, which are somewhat common sense, but you can also help to mitigate that, knowing whether I'm injured or not, which leads me to my next stuff. So to run or not to run. So these are some guidelines to say, okay, I've felt something, a little achiness here, a little stiffness there, should I run or should I not run? Okay, so if there's no pain with, I felt a little run during my run or slightly after my run yesterday, but, today I feel pretty good. I don't have any pain during my regular activity of living. I don't really have any problems walking, going up and down stairs doesn't bother me. You can probably still run. Okay, if you've got minor pain or stiffness that's only present at the start of the run, you feel it in the first block, first kilometer, but then it goes away, you're probably also okay to continue to run. And or if you've got mild discomfort that doesn't worsen as you keep running day after day. So I felt it, it's mild, and when I say mild, I mean 0 to 10, definitely less than 4 out of 10. So mild discomfort that's not causing a major pain response. This links back to our tissue threshold. Go ahead, Jenna.
I was just going to say this links back to when we were talking about freedom of movement.
Yeah.
That's a term you like.
Yeah, I do.
And at this point, working on more mobility and stretching and core work as well. So if you're feeling those things, say to yourself, maybe I should be doing more strength training.
Maybe I'm starting to breach my injury threshold.
That's right.
And I need to stop, take a rest day, or do active rest, or work on my flexibility, or target my strength to build my threshold back up again so that I'm ready to go. And that's building up your tissue tolerance. Another thing that you can do is if you can change your tempo, change your shoes, change something so that the causative factor is now reduced. So if you can fit into the top 3 points, if you can modify something you're doing running, whether it's distance or tempo, and again, general stretching, if general stretching or simple exercise help to keep it under control on a regular basis and it doesn't get worse. Now, don't run. Obviously, if there's substantial bruising or swelling, you don't run. Okay, if you can't run, you don't run. If the pain is intense and gradually worsens, so you start off a run, it's mild discomfort, and as you run, it progressively gets worse and worse, starts to breach that minor injury threshold of now it's getting towards a 4 out of 10, you need to gear down and stop. Okay, and if you're pushing through it, but you're altering your running form, not only will that not fix things, it may make things worse or might cause other problems as well. Now, going back to that, if you haven't been able to mitigate it by doing some of those modifications we just talked about, doing some active rest, doing some focus strengthening, you can always, number one, whenever you have an injury, I recommend you do consult a healthcare professional, someone who's knowledgeable in musculoskeletal medicine, has a background in some running-related injuries. Rest is always good. You can always do your rest, ice, compression, and elevation, so doing some self-treatment. And another thing that's really simple for those mild discomfort post-run or while you're managing it on your own is self-massage with movement is a good way to help mitigate a lot of mild aches and pains. It's something, and if it helps, great, you do it. If you find that your injury is still getting worse, you need to stop and come see a healthcare professional for sure.
Okay, well, thank you so much, Andy, Jenna. We're going to move to our questions now. So if anyone has a question, this is the time to put it in the box, and we will address them shortly. I'm just going to take a few moments just to speak to sports therapy and rehabilitation at Medcan. So our multidisciplinary sports therapy and rehabilitation team provides you with evidence-based therapy, and we have a wide range of specialists working with Andy from chiropody, chiropractic, massage therapy, and physiotherapy. So if this is something that you are interested in, it's something that Andy mentioned, piqued your interest, you'd like to have a specific case examined, please do not hesitate to contact us at medcan.com or call us or email us at the numbers provided on the screen. And Jenna is part of our personal fitness training team here at Medcan. And as you heard today, her expertise demonstrates, a focused learning and coaching. And at Medcan, we focus on helping you build your strength and mobility so you can live life to your fullest. And we offer a facility dedicated to personal training, a beautiful facility. And we also have fitness professionals like Jenna who have deep expertise with a wide range of specialties and training tailored to your personal goals. So if that is something that interests you, please call us at the number on the screen and the contact email right there, fitness@medcan.com. Okay, so now we're going to move to questions. So we have a few questions, and the first one is, I've heard that osteoarthritis is caused by running. Andy, how about you take that one?
That's a great question, actually. There's a lot of people feel that, that running will cause knee osteoarthritis or arthritis of your knees. And although I did say that running pain, or the number one area of body pain that people report is knee pain, actually the evidence doesn't support a strong association with running and the onset of osteoarthritis. There has been several studies looking at it, various quality of those studies, but the general consensus is the vast majority of those studies haven't found a strong association with running, outside of the other risk factors that we already know for osteoarthritis of the knee, for example. This you could relate to hip, but specifically with the knee, risk factors for early onset or progressive osteoarthritis of the knee is higher body mass index, so being heavier body weight, right, and previous injury. So if you have a history of bad knees, meaning you've injured them in sports, you've had a meniscal injury or a ligament injury and you've damaged it, or you've had intermittent knee pain, for the most of your adult life, and you're carrying extra body weight, maybe we could try something other than running as a start. Not that running would be bad for you. It's just we may need to be more specific about cross-training and building up your tissue tolerance, your resilience, and specifically maybe looking at your mechanics before you went to run. Mm-hmm. And we also know that risk factors for arthritis isn't directly running. In fact, especially if you're doing more mild to moderate level running, so meaning less than 30 to 40 kilometers per week, the probabilities are high that will not increase your incidence of arthritic change. It's genetics, previous history of injury, body mass index, a little bit of bad luck probably, more likely than the fact that you're running. In fact, the incidence of osteoarthritis in the general running population is lower than the average population.
Oh, interesting.
So there's not a direct cause and effect.
The next question, actually, it's related. Maybe Andy, you could take this as well. Is running bad for your back?
Also, I've heard that a lot from patients that come in, they're runners and they've injured their back and they feel pain when they run and they wonder if that's bad, meaning should I stop running? I've heard that there's a lot of pounding with running, right, and compressive loading. Mm-hmm. And I can say emphatically no. In fact, just like with sort of osteoarthritis, the incidence of low back pain in the running population is lower than the average population. Back pain in general hits about 80% of the population. And actually, if you look at runners, it's slightly less than that. So running is not a direct cause or effect of low back pain. Now, there are certain types of back injury that might be aggravated by running, and depending on where you are in the recovery spectrum of a low back injury, like whether you're really acute, it just happened, or whether you've got disc herniations with radiculopathy or nerve compression, then yeah, jumping right back up to training for a marathon is probably not wise and will probably aggravate things. But when it comes down to recovery from injury, it's about slowly and progressively, one, finding what the problem is, and then slowly and progressively building up your resilience to that tissue injury, meaning building your injury back into health. And to do that, you need to do two things, basically, in a nutshell, is minimize the aggravating, propagating, and perpetuating factors, and then you need to promote healthy tissue. And so if your goal is to return to run or start running, that's not saying you can't. You just need to be smart about how you do it. So periodization, proper nutrition, proper rest patterns, proper strengthening, proper body preparation is how you do that. So short answer, no, running does not cause back pain.
Thanks. Jenna, the next question is for you. There are a lot of running crews, especially in Canada, Toronto, Edmonton, Vancouver. What are the benefits of running with a group and running maybe with a personalized coach or just on your own?
Right. To me, it really depends on your personality. For myself, I have seen some people that don't love running in crews. I mean, if you start running because you actually enjoy the personal aspect of getting out and having some quiet, that's really nice to perhaps even start out with a running coach one-on-one. I think there's a bit of danger sometimes in starting with a crew if you're competitive by nature and you push yourself too quickly, or it's also going to be a generalized program. Some people are going to progress quicker than others, and especially if you're dealing with a little nagging pain, you're not going to think about it because you're with a crew and you want to keep up. So I think starting out, I'm always a little bit cautious in telling people to find a crew. I think getting that proper one-on-one coaching is ideal. And then as you're feeling more confident and have more awareness of your body and how your mechanics should be as you're striding, that's a really great time to move into running a running program as a group. There are tons out there, and they're amazing, and they're effective, and they're nice because they join, they'll have proper progression towards different races, but just remember that there's always that competitive aspect and ability to get injured if you're competitive, which I see a lot. Pushing through your pain, right? Yeah. That's going to happen more often.
Well, thank you so much, Jenna, and thank you, Andy. Just this week, a study came out that running, for every hour of running, you're adding, minutes to your life, and it really adds to your longevity. So I'm sure all the
exercise is medicine.
Yes, exactly. Well, thank you so much for helping our participants learn more about this. And
pleasure.
Yeah, thank you everyone for joining us. Hope you have a good evening.
Thanks, Tanya.